Mastering live-in caregiver interviews. ACE questions using STAR technique. 10 commonly asked interview questions for a live-in carer role and sample answers using the STAR technique. Situation, task, action, result. Question. Tell me about a challenging situation you faced while providing care. How did you handle it? Answer using STAR technique. Situation. During my caregiving role, I encountered a situation where the client's health suddenly deteriorated, and they required immediate medical attention. Task. My task was to remain calm and promptly assess the situation while prioritizing the client's safety and well-being. Action. I quickly contacted emergency services and followed the client's care plan, providing necessary assistance and reassurance until help arrived. Result. The client received timely medical care, and my composed response ensured a positive outcome in a challenging situation. Question. Describe a time when you had to communicate effectively with a difficult family member or colleague. How did you handle the situation? Answer using STAR technique. Situation. I had to communicate with a difficult family member who was concerned about the care provided to their loved one. Task. My task was to address their concerns and maintain a professional and respectful dialogue. Action. I actively listened to their concerns, empathized with their perspective, and provided transparent and accurate information about the care being provided. Result. The family member appreciated the open communication, and it helped to build trust and improve our working relationship moving forward. Question. Give an example of how you prioritize and manage your daily caregiving tasks efficiently. Answer using STAR technique. Situation. In my previous role, I had multiple caregiving tasks to complete within a limited time each day. Task. My task was to efficiently manage and prioritize these tasks to ensure the client's needs were met appropriately. Action. I created a daily schedule, prioritizing essential tasks based on the client's care plan and immediate needs, allowing for flexibility to address unexpected situations. Result. This approach improved my time management, ensuring all crucial caregiving tasks were completed effectively while providing quality care to the client. Question. Describe a time when you observed a potential safety risk for your client. How did you address it? Answer using STAR technique. Situation. I noticed a safety hazard in the client's living space that could have posed a risk to their well-being. Task. My task was to promptly address the safety concern to ensure the client's environment was safe and secure. Action. I brought the safety issue to the attention of my supervisor and made temporary adjustments to mitigate the risk, ensuring the client's immediate safety. Result. The client's living space was made safer, minimizing potential risks and contributing to their overall well-being. Question. How do you handle conflicting priorities and demands in a caregiving role? Answer using STAR technique. Situation. I faced a situation where the client needed immediate assistance while also having scheduled appointments and tasks to complete. Task. My task was to balance and prioritize these conflicting demands to ensure the client's needs were met while adhering to their care plan. Action. I communicated with the client to understand their immediate needs, rescheduled non-urgent tasks, and collaborated with colleagues to manage the situation effectively. Result. The client's urgent needs were addressed promptly without compromising their overall care plan or scheduled appointments. Question. Describe a time when you had to adapt to a new caregiving environment or client. How did you approach the transition? Answer using STAR technique. Situation. I transitioned to a new caregiving assignment with a client who had unique care requirements and preferences. Task. My task was to quickly adapt to the new environment and establish rapport with the client to provide personalized care. Action. I researched the client's medical history and preferences, communicated with the client to understand their needs, and adjusted my caregiving approach accordingly. Result. The client felt comfortable and satisfied with the care provided, and we built a strong caregiver-client relationship. Question. How do you handle a situation where a client expresses dissatisfaction with the care they're receiving? Answer using STAR technique. Situation. A client expressed dissatisfaction with certain aspects of their care, and it was important to address their concerns effectively. Task. My task was to listen to their grievances, acknowledge their feelings, and work towards resolving the issue while maintaining a positive and respectful relationship. Action. I actively listened to the client, validated their concerns, discussed potential solutions, and collaborated with my supervisor to make necessary adjustments to their care plan. Result. The client felt heard and valued, and the changes implemented improved their satisfaction with the care they were receiving. Question. How do you maintain a high level of patience and empathy in challenging caregiving situations? Answer using STAR technique. Situation: I encountered a challenging caregiving situation where the client was frustrated and agitated due to their health condition. Task: my task was to remain patient, understanding, and empathetic while providing the necessary care and support. Action: I took a deep breath, maintained a calm demeanor, and communicated calmly and respectfully with the client, addressing their concerns and fears. Result: the client felt more at ease, and my patient and empathetic approach helped to escalate the situation and improve the overall caregiving experience. Question: describe a time when you had to collaborate effectively with a healthcare team or other professionals to provide the best care for a client. Answer using STAR technique. Situation: I was involved in the care of a complex case, and collaboration with other healthcare professionals was crucial to ensure comprehensive and effective care. Task: my task was to communicate and collaborate with doctors, nurses, and therapists to develop and execute a cohesive care plan. Action: I actively participated in interdisciplinary meetings, shared valuable insights, and contributed to creating a holistic care approach for the client. Result: the collaborative efforts resulted in improved care outcomes for the client, and the team's unified approach enhanced the quality of care provided. Question: how do you prioritize maintaining a client's dignity and respect while providing personal care? Answer using STAR technique. Situation: I encountered a situation where I needed to assist the client with personal care while respecting their dignity and maintaining their sense of privacy. Task: my task was to provide the necessary care while ensuring the client felt respected and comfortable throughout the process. Action: I communicated with the client, explained the care procedure, sought their preferences, and maintained a respectful and professional approach during the entire process. Result: the client felt respected and valued, and their comfort and dignity were preserved, fostering a trusting and positive caregiver-client relationship. Remember, when using the STAR technique, focus on providing specific and detailed examples to effectively showcase your experiences and competencies. Remember to subscribe to our channel for more tips to nail that job interview.